Okay, thank you. Hi, everyone. We're going to go ahead and get started now, just to honor your time. So first, we'd like to welcome everyone. I'm Jane Alvarado. I'm the program coordinator with California Project Lean, and Project Lean stands for Leaders Encouraging Activity and Nutrition. And Project Lean is a program of the California Department of Public Health. Today, California Project Lean and the Dolores Huerta Foundation, Central Valley Health and Nutrition Collaborative, Arvin School District, and Kern County Health Department, and many other partners are joining together to celebrate the ReThink Your Drink media campaign that encourages Central Valley residents to rethink their drinks and improve the health of their families. Today, we'll discuss the importance of policy changes to help families in the Central Valley choose healthier beverages, such as water and non-fat 1% low-fat milk. 1 in every 9 California children, 1 in 3 teens, and over half of adults are already overweight or obese. The obesity epidemic affects all age, income, educational, ethnic, and disability groups. California's cost attributed to fiscal inactivity, obesity, and overweight in 2006 were estimated at more than $40 billion. If California made progress at reducing the rates of fiscal inactivity, obesity, and overweight, this state could realize an annual savings of nearly $2.5 billion. California Project Lean has funded the ReThink Your Drink media campaign through its Community Putting Prevention to Work grant from the American Recovery and Reinvestment Act. The goal is to combat overweight and obesity. This grant supports educational, policy, and environmental changes, efforts that promote increased access to healthier beverages while also reducing access to sugar-loaded drinks in schools and community settings. Many residents do not realize that there are 22 packs of sugar in a 20-ounce soda, and better yet, don't realize that there are 12 packs of sugar in every electrolyte replacement beverages, such as a sports drink. Sugar-loaded drinks lead to many serious health problems, like obesity, type 2 diabetes, heart disease, and some cancers. As you can see, there is a lot of sugar, which is being represented here by these glasses today, in some of these beverages. We know that the prevalence of overweight and obesity is higher among Californians who drink sugary beverages than those who do not. For children, each extra can or glass of sugary beverage consumed per day increases their chance of becoming obese by 60%. The ReThink Your Drink campaign includes media materials designed to reach mothers who are often the gatekeepers of children's health. The products include a 30-second radio commercial in English and Spanish, posters which you see here, both in English and Spanish, and fact sheets, which are also in English and Spanish. So now we're going to go ahead and play those radio spots for you.
20, 21, and 22.
You're not thinking about eating those 22 packs of sugar, are you, honey?
Why not, Mom? You drink them every day.
What are you talking about?
There are 22 packs of sugar in a 20-ounce soda, and sugar-loaded beverages may lead to obesity, type 2 diabetes, heart disease, and some cancers. Rethink your drink. Instead, choose water and low-fat 1% or non-fat milk for your family. Brought to you by the California Department of Public Health.
And do we have the Spanish one as well?
Yes.
Veinte, 21 y 22.
No piensas comerte esos 22 paquetes de azúcar, ¿verdad?
¿Por qué no, mamá? Tú te los tomas todos los días.
¿Qué?
Un refresco de 20 onzas contiene 22 paquetes de azúcar y las bebidas azucaradas pueden contribuir a la obesidad, diabetes tipo 2, enfermedades del corazón y algunos tipos de cáncer. Piensa bien lo que tomas. Elige agua o leche baja en grasa 1% o sin grasa. Patrocinado por el Departamento de Salud Pública de California.
So, California Project Lean is working with partners across the Central Valley, such as the Arvin School District and the Dolores Huerta Foundation, from whom you'll hear with later today. I want to congratulate these organizations for beginning to address the obesity epidemic through their agencies. If more Central Valley organizations make similar policy strides together, we will see continued improvement in the quality of life for Central Valley residents. Thank you so much.
Good morning. I am Dr. Avtar Nijjer-Sidhu, and I'm a senior health educator with the Kern County Environmental Health, a division of the Kern County Public Health Services Department. And we are here in great support and partnership of this campaign of Rethink Your Drink. And so much so that the Kern County Public Health Department recognizes that Kern County is facing an obesity epidemic. In 2005, it was reported that approximately 66% of the Kern County population was either overweight or obese. And in 2005, it was reported that 36% of the adults drank one or more sodas per day. The Public Health Services Department in 2009 launched the Call to Action, a Chronic Disease and Obesity Plan to address the obesity epidemic. The Call to Action is in partnership with 7 other domains, and some of the focus is to create a healthier environment in which there's access to healthy foods and beverages. The Public Health Department has written comprehensive policies around worksite wellness and lactation, and we support a healthy work environment. And then we have placed in our break room signs that advocate about drinking water. We also support the idea that health choices and a healthy lifestyle begin at the very beginning, and so we promote a lactation room for many of our nursing mothers who come back to work and who are trying to provide the best source of nutrition for their newborns. In addition to our work outside of the Public Health Department, we have been in great partnership with the Dolores Huerta Foundation and worked closely with them on their sugar sweetened beverage grant, worked around education and initiative and policies to educate the community residents on the concerns of excessive consumption of soda. So much so that we supported the Dolores Huerta Foundation's action of removing all sugar sweetened beverages at our Building Healthy Communities in the South Kern area, which took place, I think, earlier this year. That was a great move, a part of their foundation, and we were really happy to support a cause of that. In April, our public health director had been interviewed by the local news department's, local news station here around the sugar sweetened beverage, the soda tax, and to sum it up, what was well said by my director, there is no nutritional benefits to soda. There just isn't anything nutritional about it. So then the concern becomes, why do we want to take it into large amounts? Likewise, we are also supporting many of our other domain partners, the schools in particular, who have done a great job of removing vending machines around soda. And we support their environments, support their efforts in creating healthy environments for their students, especially increasing the access to water. The Kern County Public Health Services Department has also received other funding from local initiatives as well as statewide and national grants, all around the work on Rethink Your Drink Campaign. It's a huge priority for us here in Kern County. Through the Rethink Your Drink, we have a unique partnership, as we mentioned, with the Dolores Huerta Foundation, the Arvin Union School District, California Project Lean. What a wonderful opportunity to come together in Kern County and really send the message home that you have the power to make a really healthy choice for yourself and your families. The Kern County Public Health Services Department, we acknowledge that there is still a lot of work to do. We're facing a great epidemic battle, but this is just one change we can make in creating healthy environments for all of us. Thank you. Excuse me, and now I'd like to introduce Dolores Huerta, the Dolores Huerta Foundation.
Good morning. Thank you very much for coming. And I want to, first of all, I just want to thank Project Lean, not only for bringing us the information, but bringing us the resources so that we are able to get this message out across, especially to the people that really need to hear it. And I'd like to have some of our people who have been through these training sessions, pasen para acá, por favor, because these are the folks that have been attending, Sandra. They have been attending these workshops that we've been having. They're getting it out. These are part of our neighborhood organizations that we have in 7 different communities, 4 in Kern County, 3. By the way, we're also doing this in Tulare County, so it's not limited to Kern County. And also we're also part of the collaborative of Building Healthy Communities. We have our program manager here today, Annalisa Robles, and Nina, who's back there. So basically, by all of us working together, we're able to get this message out about not drinking the sugar-sweet beverages and kind of promoting aguas frescas, which is plain fruit water that is very popular in our Latino community. Also, milk that is low-fat milk, and also juices that have 40% that are juices and very little sugar. And of course, other kinds of milk like soy milk, almond milk, all of the other rice milk, other kinds of milks that people can use so that they can get this healthy lifestyle. Also, as part of the Building Healthy Communities, we're also in Lamont, Arvin, Weedpatch, and Greenfield in Southern Kern County, we are not limiting this just to the sugar-sweet beverages, because we are also promoting physical exercise. So we have walking groups that have been formed now so that people can get the kind of exercise that they need. And we know that this is so important to everyone, and so we want to challenge other organizations. I believe with our collaborative with Building Healthy Communities and our foundation with our community organizations, we have already reached hundreds of people. You know, we love this wellness policy, but we want to then challenge and say we've got to reach thousands, because if we can do this, we know that we can cut down on medical costs, that we're going to have healthier communities, and especially we're going to have healthier children. So, Project Lean, we thank you very much. Sí se puede. We can do it. Okay? Gracias. Gracias. Yeah, this is Mr. Gonzalez, Tony Gonzalez with HealthNet. Thank you.
Good morning. On behalf of HealthNet Community Solutions, we thank you for being here today in support of the ReThink Your Drink campaign. HealthNet Community Solutions, Central Valley Health and Nutrition Collaborative Partners, and everyone here today truly cares about the health and well-being of our families, and together we can make a difference in preventing childhood obesity. We know that poor diet, inactivity, and obesity contribute to risk factors such as heart disease, type 2 diabetes, cholesterol, among other chronic diseases. And that's why we're working so hard to bring together better health outcomes for our residents of Kern County. Today we're asking our schools, medical providers, and community-based organizations to come together and take action by providing community members with information about the ReThink Your Drink campaign and detailing the high sugar and calorie content of popular sweetened beverages. This will empower them to make healthier choices and rethink your drink campaign. The ReThink Your Drink campaign materials are designed to reach mothers, who are often the gatekeepers. Part of this ReThink Your Drink campaign includes a pledge card. And the pledge card basically tells our community members to make a commitment to rethinking your drink and also reducing the sweetened beverages that they consume. So how can you get involved? Schools can implement wellness policies ensuring clean water is available for all students, and that fountains and clean water are readily available around school campuses. Youth organizations and nonprofits can also help by committing fundraising activities that promote healthy habits and beverage choices, of course. Healthcare professionals can promote healthy beverage choices in their provider offices with their patients, with the mothers that they're speaking with. These are just a few ways we can work together to impact the health of our community members in Kern County. As chair of the Central Valley Health and Nutrition Collaborative, I urge you to rethink your drink and make healthy beverage choices. Together, we can tackle the obesity epidemic in our valley. Thank you. Now I'd like to introduce Karen Davis from the Family Resource Center.
Good morning. My name is Karen Davis. I'm the Family Resource Coordinator for the Arvin Union School District. I'm here today representing Dr. Michelle McLean, the Superintendent of the Arvin School District. Arvin Union School District has taken a leadership role in improving the nutrition environment for our 3,200 pre-kindergarten through 8th grade students. When we think about children growing up healthy, nutrition and diet are extremely important. When a child's diet is poor, their health outcomes can be severe, such as developing type 2 diabetes. Nutrition for students is a priority for the Arvin Union School District. We understand that students who have access to healthy meals perform better in school and are more likely to achieve academic success and help decrease school absenteeism. At Arvin Union School District, the superintendent, Dr. Michelle McLean, the food service department, the school board, staff, and parents are committed to creating healthy environments for students because we know that health happens in schools. We are addressing the health of our students in several ways. decreasing access to flavored milk and electrolyte replacement beverages, sports drinks, in schools and after-school programs. These beverages are currently available for sale by state law, but we feel that these drinks are unnecessary as they provide additional sugar that is not needed by our students. Providing all students and employees with access to clean, safe, free drinking water in all cafeterias. We're serving healthy breakfast in classrooms every morning. We are offering fresh fruits and vegetables at recess 3 times a week. We're partnering with parents and students to educate them about the change to school meals. We're working with school staff to implement changes and become champions for school health. And we are creating healthy environments for our students by strengthening our school wellness policy. Because what we do in our schools has the ability to affect the health of our students, I'd like to encourage other school districts in the San Joaquin Valley to adopt similar measures, especially by limiting access to sugary beverages. We are implementing these programs as part of the Building Healthy Communities, a 10-year plan of the California Endowment. This is a grassroots effort led by the residents of Arvin, Greenfield, Lamont, and Weedpatch in cooperation with their organizational partners to lift up the health of the community. By working together, the goal of the South Kern Building Healthy Communities is that we make a place where every child and adolescent is healthy, safe, and ready to learn. Increasing access to healthy foods in neighborhoods and schools is one of the many priorities South Kern residents and organizations who are working in partnership to make healthier South Kern a reality for our children and our families. Thank you.
Thank you so much for coming. I'd like to thank all of our speakers, and I'd also would like to invite all of you to please take the time if you'd like any follow-up questions with any of our speakers. I'd also like to let you know that we do have some parents here available as well if you would like to connect with them. Thank you so much.